Greetings. Now, there are some pregnant women that always complain of pain in their hands. Yes, they complain of pain in their hand. When I say hand, it means from the wrist down to the fingers. This is what is referred to as hand medically. So they complain of pain in both hands or pain in just one hand. And this pain is worse when they wake up. The hand is painful. Another issue with this hand is that apart from the pain, you'll be feeling this tingling sensation as if they are pricking you needle on the fingers, on the hand. Can be painful, and the pain is always around from the thumb to the middle finger, to the first finger, then to the middle finger. It's like this, from this side down, from the thumb, first finger, middle finger. The pain is so bad, it can be distressing. Sometimes the pain will be so bad that you will not be able to sleep. Now, what caused this pain? What is the reason for this pain? See, there is a syndrome called Carpal Tunnel Syndrome. What did I say? Carpal Tunnel Syndrome. Look, there's a gutter in this your hand. Let me use a bridge in this your hand. And you know how a bridge, normally, we build bridge across rivers, right? Now, there's a bridge in this your wrist here. A bridge. Now, under this bridge, normally water is supposed to pass under it, right? Now, for human beings, under the bridge here, there are certain structures that pass under it, like nerves. There's a nerve that passes under this structure here, under the bridge here. There's a bridge here from here to here. There's a bridge. There's a nerve that passes under it. Now, because you are pregnant, apart from the nerve, there's also blood vessel that pass under it. Whenever you get pregnant, because you are pregnant, in some women, not all women though, in some women, whenever they are pregnant, water accumulates. There's excess water in the human body, and some of the tissues in the human body, also in the pregnant body, also swell. Because the tissues swell, the bridge that is here will become narrow and will now start compressing on the nerve that passes through here. And it is the nerve that supplies this finger, and this finger. You understand? Is that nerve that supplies this finger, the thumb, the first finger, and the middle finger. So because this nerve, because of the swelling, sometimes you notice that your hands are swollen. You know, just the same way some women, just the same way their feet are swollen, their hands are also swollen. Their hands are also swollen. And it's common with these women that their hands are swollen. Their hands are swollen from here to the tip of the finger. Now, because it is swollen, the space where this nerve pass under, you know, there's a bridge here I told you, the space where this nerve is narrowed. Because it is narrowed, it will now be pressing on the nerve that supply your hand. For example, let me use this example now. Now, imagine this is the nerve that pass under the bridge in this your hand. And this is the nerve that pass under the bridge. Now, because the space is now so narrow, what will happen is that the bridge will not be under the bridge will not be so small for the nerve to pass through. So the nerve will not be compressed. So it will be something will tight around it like this, and that's why your hand will be paining you. It can be excruciating, no? And sometimes you'll be telling your doctor will not really want to, or not necessarily doctor, you'll be telling your husband or your partner or your friends or your family members that these my hands are paining me. They don't really know why your hand is paining you in pregnancy. And you will notice immediately you give birth, once that water starts reducing in your body, the pain will subside. This pain is usually worse in the mornings. And it's also it can be painful. Some women are rushing to the hospital crying and in severe pain because of this issue I told you about. It is called Carpal Tunnel Syndrome. Carpal Tunnel Syndrome. You know what I mean? What tunnel mean now? The tunnel through which that nerve pass under, is now narrowed to the extent that it's now compressing the nerve, and that is what is responsible for the pain. It can be excruciating. See, if you want to test if it's carpal tunnel syndrome, do your hand like this. If you do your hand like this for like 30 seconds to 1 minute, or from 30 seconds to 1 minute 30 seconds. Hmm? Yeah, from 30 seconds to 90 seconds, you will notice that the pain will increase and become excruciating, because this position reduce the space under which the under the bridge further, and the nerve becomes more compressed, and it can be very painful. So this is called the Fallon's test. I don't want to, I don't like talking too many medical jargons when I'm giving my trying to talk to you, so that you understand. Just do your hand like this. Wait for like 30 seconds or 1 minute and see. You will notice that the pain will become worse. It's not for every woman, no. I mean, the woman that noticed that there is pain in the hands, try it and see. Now, how do you relieve this pain? Normally, for women that are not pregnant that present at the hospital, or not necessarily women, it also occurs in men. It occurs in men, but it's just that it is more pronounced in pregnant women. It becomes worse in pregnant women. It's also found in pregnant women, as I said. Surgery is usually what we offer them. Surgery. So that we can relieve the bridge, open up the bridge so that the nerve can pass freely. You will notice that immediately the surgery is done, you feel relief. But you are pregnant now. It's not every woman that is pregnant that we offer surgery to, except the pain is very much. So I will just give you some home remedies. What you need to do when you have this pain is this: you look for warm bottle, like warm water, boil water and put inside a bottle. Eh? Then apply it gently on the hand. You will notice that you will have some relief. This pain, sometimes paracetamol cannot relieve it. And you are pregnant, you cannot be taking every drug. Hope you understand. So put warm water, just boil water, put inside a water bottle, or this compression bottle that you can use to have, or better still, what you should do is this: put pure water inside hot water. When it's warm enough, remove that sachet water, and apply it on your wrist here. You will relieve. See, it will help relieve the pain and the pressure on your nerve here, and you feel so much relief. If you cannot do that, there are other ways. What you need to do is that get ice. Look for ice pack or ice water. Look for sachet water that is already block. Yes, I mean block. Or swan water, swan bottle that has block, or block generally. Look for block and apply it. Blocked water, ice. Apply ice directly on your wrist here. Here, leave it there for some time. It will help relieve the pressure that is in this wrist here. Once it relieves it, the pain will reduce and you have some relief again. This pain is usually worse in the morning when you wake up. The pain can be excruciating. It is called Carpal Tunnel Syndrome. Do you understand? Please, if you don't understand, or if you have any question to ask, put it in the comment section. I will answer you. This video is already very long. Bye-bye.